we need it, he'll let us know. He is the director, of course, of the Jesse Brown VA, none other than Mark A. Miguel. How are you?
Hey, Cliff.
Great to see you.
Great to see you. And I tell you, it's really an honor that you say co-host, an honor to be with America's heroes here and talk about issues that help our veterans.
Well, we've done so much at your organization there, and you've done such a great job in helping us to get the word out, and we just appreciate you. And of course now we have a 2-hour show, so it's been expanded from one, so there's a lot of information, and can't do it without you.
Hey, that's great.
Great.
Well, I like to talk about services that we can provide our veterans, and
That's right.
talk about that all day. But I'll try to do good on time here. But like to talk about how VA services are unique. Truth is that healthcare system that VA has can't be matched. And the reason for that, there are lots of reasons, but some of the very unique services and programs that we offer. And today is a little bit different. Wanted to talk about several programs that are available to folks right after discharge, as soon as they discharge. And in fact, those services are designed to help them transition. So we actually have two guests. And I guess at the top of the hour here, I'll introduce our first one.
Mm-hmm.
Dr. Holly Passy is a licensed clinical psychologist at Jesse Brown. She's our program coordinator for the Vital Student Veteran Outreach Program. And that program, actually, I'm going to let her tell you about it, but it helps provide care coordination and other services and outreach to veterans. And so Holly works with campuses across the city to connect with student veterans and tell them about the VA. Holly received her doctorate in clinical psychology from Roosevelt University in Chicago, and she's worked with the Department of Veteran Affairs since 2012. So Holly, welcome.
Thank you. Thanks for having me to talk about
Thank you for
the
coming.
VITAL program.
Right.
Just start from the top and give you the basics of what the program is about. Of course, it has to be an acronym, the VITAL Student Veteran Outreach Program. It stands for Veterans Integration to Academic Leadership. And the idea behind the program is that for veterans coming out of the military and coming onto campuses, we don't just want them to be marginally successful. We want them to be doing well and to have the supports in place for them to be doing well academically and to move on to the next stage of their life. The program really evolved out of a couple contexts, and I'll talk about one and then the other.
Mm-hmm.
One is that many veterans, when they are coming out of the military and trying to figure out what the next step of their life is, one of the first things they think about is going back to school because they have these great GI Bill benefits. And they go back on campus. This is one of the main access points to begin the integration to civilian life. And the VA, I think, is aware that they are going there first to use that benefit, but in the transition may be getting lost to the VA system and not making it over to be receiving or engaging in benefits that might be really helpful and services that might be really helpful to them. So that's the first current point of context for it. But the other point is a historical point of context in that our Vietnam era veterans struggled quite a bit more in the aftermath of coming home from the wars, and that they came to a public environment that was kind of maybe hostile. There were not as many supports in place for veterans. So I think programs like this are the VA's effort to be really a lot more proactive with this generation of returning veterans and not kind of wait for crises to happen, but really to go out into the community and engage people at points before they might be in a bad place. So I think when veterans are returning, they go on campus. They are focused on that. It's kind of a younger generation at this point, usually between the ages of 25 at the younger end, maybe 45, 50 at the older end, people who have been in the military for a long time, coming back to school. And they have different needs depending on how long they were in, what their job was there, what those experiences might have been, and the extent to which they may have acquired a mental health or a medical condition while they're in the military. And that's really going to vary in that population. But as they come back, they go to class, they're in classes with traditionally aged students, and they may start to realize the impact some of their service may be having on their academic performance. And this is often, the first place where they may start noticing struggles. So the Student Veteran Outreach Program really aims to put a VA expert out on campuses to be there during that time and to be a helping hand that's very visible on the campus, so that they aren't just out there on the campus struggling and not really knowing where to go or what to do. So that's the gist of the program, and I can certainly go into more detail about that.
Well, that's just great, Doc, because I'm sure that someone in that situation would really have a problem if it were not for this program, because where would they go?
Yeah,
it's just great that you have that program.
It is.
Yeah.
I think that's a good question, and the answer to that question is the VA is a good place to go.
Yeah. But this is a special program you have.
It is.
Yes.
And I think it's here because my opinion is that being kind of an insider, if you'd want to say that, is that I am aware of the really extensive nature of VA services, particularly really mental health, medical services, that it is specially tailored for this population in a way that no other system is. And there's a lot, and it's complex, and it's a big system, and that's great. The irony of it is that it can make it intimidating and difficult for people to navigate. And I think that's what this program tries to do, is to make it more personal, to give you a person to connect with me on campus who's visible. And I'm generally not intimidating. I'm pretty approachable. So that's helpful. To feel like...
Generally, you say.
Generally.
Yeah.
So I'm approachable and usually not what they may have heard about the VA. And I try to be a person that gives them professional guidance through that system.
Well, that's one thing that I certainly can attest to personally. Some of the things I have heard about the VA in the years past have certainly not been all good. And what is happening, and I'm so happy that we started this show, because the things that the VA does now, I don't know how you could do any better. We've got so many people, and then we've had folks with complaints, and we refer them, and they're taken care of. So, this is why this is such a good thing. But, I imagine, Dr. Passy, that a lot of those people that, thank goodness you're there to help them, would probably, when they see the problems that they have, if it were not for you being there, would just drop out.
That is what we would like to avoid.
Yes, that's what I'm saying.
Yes, absolutely.
Yeah. Because just going back to school in itself,
it's hard enough.
Exactly.
It's hard enough.
Exactly.
It's
hard enough. But then,
especially when you've been out of the classroom for maybe many years,
Sure.
and I think there's a lot of challenges there, and the challenges really, depend on what else you might be dealing with other than homework or classes, because that's challenging anyway. And I can tell you, having been in school for a long time before this point, that it's challenging as it is. But if you're also trying to navigate symptoms of post-traumatic stress or chronic pain or traumatic brain injury, it's even more so. But I feel like veterans can go there and have struggles and get demoralized, and as you say, feel like dropping out, or as if they can't do school anymore and it's just not for them. And that is concerning, and I think it can be heartbreaking, because the truth is that a lot of these veterans can be successful with the right resources and supports. And so I hope that, by connecting with the program, we can start to get them those supports, because it can be the difference between success and failure, not only at school, but in the transition.
Certainly.
Generally, because we know how important employment and education is to the reintegration process.
Now, one of the things, that's one of the reasons is, that we have this show. But I hope, Dr. Passy, that students who may be having that problem are aware of what you offer. So how do they get the information? Generally, you know what I'm saying?
So that's
Yeah.
an excellent question. So, I do direct outreach to student veteran association groups, and
Good.
I go to a lot
Good.
of the student veteran events on
Great.
campus to introduce myself. And, many people find the idea of engaging with a psychologist to be distressing. So I just try and make apperances
As
and
you
make.
say, you're not frightening, though. You're
I'm not.
Now, see, Cliff, if I tried to do that,
Yeah, exactly.
They have a certain
Exactly.
idea of what a psychologist is, basically.
right,
It's usually
yeah.
not me.
That's true.
actually, you could pass as a student.
Yeah,
Right?
she could. Yeah.
So I go and try and make myself a natural part of the environment to destigmatize, engaging with somebody in a field like mine. I also, I'm not just doing direct outreach with veterans, but I'm working extensively with the campuses themselves, because many of these campuses, they want to engage this population, but they don't know how to do it, and they don't know what the resources are. So I go and I create partnerships with those campuses, and I work with campus administrators. I work with staff and faculty. I do a lot of staff and faculty trainings about, here are the issues for veterans, here's how you can be helpful, and here's how you can link them with the VA. Basically, just send them to me, and I'll make sure they get where they need to go.
See, that's excellent, because what I was going to say, Dr. Passy, is the fact that if I were a professor, I would make sure, if I had veterans in my class, that they knew you were around. Because,
I tell them, put my information on your syllabus if you want.
That's
Like
great.
we do with writing centers or tutoring
that's
centers,
great.
like let's just have it normalized and worked into the fabric of the campus so that it's not like a side issue.
Right.
Let's make it a issue that's front and center and visible to everybody.
That's great. And how long has this program been going?
So
With you? Yeah.
so I have, for our program here, I've been coordinating it since 2012.
Great.
The program's been around nationally, I think, for 9 or 10 years now at VAs around the country. I think it's very innovative for the VA. And another thing I'll mention in terms of visibility is that there's some campuses where I actually do therapy on campus, where I go outside our walls of the VA and provide the service there. So that, we really want to make that access easy so that veterans can come between a class and not have to travel all the way over to the VA, and it feels like part of their educational experience.
That's a wonderful program. Great.
And what's
Yeah.
nice about
Yeah.
this also is it's not just, it's at the community college level.
Yeah.
I think we have some student veteran associations with the colleges and graduate level as well.
Sure, that's so it. I didn't even think of that. So it's more than just to tell what levels that this is available.
Well, I engage the community college. I engage
Community
campuses,
college.
so
Yeah,
it's not
okay.
like a specific degree
I
or
gotcha.
department.
Right,
so I'm
right,
working
right.
with people who are in charge of things at the campuses.
Gotcha.
So it's a campus
Sure.
specific thing rather than a specific program or
Gotcha. For the
certification.
campus, yeah.
Yeah.
That's fine.
Yeah.
How many people would you say that you can give us any idea, Doc, that you have been able to help since you've been doing this?
Group pass around experiences, and it fits very nicely in with our concept of whole health. And what whole health, and actually that's a subject for another week, but that helps veterans set their own goals. whatever those goals may be, but to help in their recovery and makes them a part of that treatment plan. And it works. So I'm excited what we can do. And Cliff, this is an example of where I really like this director's corner that we have every Thursday, because that's where I hear some ideas directly from veterans.
That's great. That's great. Why don't
May I say one other thing with you?
Yeah, go ahead.
I'm a member of the Dory Miller Post here in Chicago, 915. Mm-hmm. We had an opportunity to address a elementary school on the west side, Jensen, who has a child parent center named Dory Miller. We were favored with the opportunity to address the student body, shared with them who Dory Miller was, and we provided an opportunity for them to participate in an essay contest. It turned out to be a great gathering. Plus, I've spoken to Mr. McGill regarding having a Dory Miller Day at Jesse Brown.
That's
and
great.
We have, I think, moved on that. I did meet with someone with Mr. Ward, who's with the volunteer department, and their new public relations director.
Okay.
So I think it's going to be a real plus for Jesse Brown as well as Dory Miller.
Sal, thank you so much. We appreciate it. Now we're going to have Mark introduce our next in studio.
Okay,
Next
and
year.
I tell you what, that was a great lead-in.
Yes,
and
it was.
Sel helped us here
Mhm.
because actually the lady that I assigned to help with this is sitting right to my right, and she's our next guest. So Miss Valerie Creedon is a licensed clinical social worker, and she was appointed at Jesse Brown in 2007, and she is in charge of our transition and care management program. Previously, she had worked in several other programs: home-based primary care, acute medical and surgical care. We stole her from Hines VA Hospital, I think back in I shouldn't have said stole, but we recruited her back in 2003. Ms. Creedon received her Master's of Social Work from the George Williams College of Social Work in Aurora in June 2004, and graduated from Morris College in Dubuque, Iowa, where she received a Bachelor of Arts degree in psychology. So welcome, Valerie.
Thanks.
You can tell about
Good to
some of
see
the
you.
programs.
Yes, thanks for having me.
Thanks for coming in.
Looking forward to some more call-ins so we can be
Great.
very interactive today.
Great.
So Dr. Passy started talking about transitioning veterans and how she's helping veterans transition and get into school and be successful there. I manage a program called the Transition and Care Management Program at Jesse Brown VA, and we're lucky enough to have a clinic dedicated to all the returning combat and transitioning veterans. It's up on the 10th floor. That whole concept of our program, it looks a little bit different at every VA, but it exists at every VA. It started, Dr. Passy talked about how veterans were experiencing their return home from Vietnam, and everyone knows that wasn't necessarily a positive experience. So I think as a whole, the community, both the DoD and the VA, were looking at that, trying to figure out how we could make that better. And in 2003, they first tried out an idea, and there was a directive to improve coordination and care between the VA and the DoD. So the Army started letting the VA know before people were transitioning home from the medical center, the Army Medical Center. And then this was working so well, in 2007, the Undersecretary for Health actually established a Office of Seamless Transition. And this started growing into a bigger and better program. And then in 2007, they decided, yep, this is definitely the way we want to go. This is actually producing positive results, and we're helping people before potentially they spiral down and feel like they're deserted. We're stepping in right away. And it became a mandated program at every VA. Now, every VA looks a little bit different. We're pretty lucky at Jesse Brown. We have a one-stop shop. So we can help veterans in our clinic. We have case managers, they're social workers, and we have a nurse case manager out at our Crown Point Community Outpatient Center. And we do care management. So anything from helping them get into the VA, get connected with people like Holly, get registered for school. They might be looking for daycare. They could be having problems because they have so many medical appointments that they're so scattered. We can maybe help coordinate, get them all in one day. We can kind of help them navigate the system that is VA, which is a federal bureaucratic system. And we can answer questions for them. We can advocate for them if needed. And we can also just help remind them they have appointments coming up.
Yeah.
Their lives get busy.
Mm-hmm.
We have in our clinic, in addition to the case managers, we have mental health providers like Dr. Passy.
Mm-hmm.
We have a full-time psychologist. We have a full-time nurse, a psychiatric nurse practitioner who can prescribe medications, a part-time psychiatrist, and we have someone who's a walk-in psychologist who can see people short-term, help with things like just trouble sleeping, the kind of more immediate needs that don't always necessarily warrant a full-blown therapy. It could be also the starting point for people who are maybe thinking about therapy and aren't quite sure that it's something they're willing to commit to just yet. Sometimes it's a scary thing to, confront your demons.
Right.
And then we have recreation therapy for veterans to help get back into society, become active in their lifestyles, not necessarily be sedentary or isolate. We do groups, we do individual services. We have things like traditional groups, traditional individual therapy. Then we have things like Dr. Prosher's Battle Body Mind Retraining. And that kind of, it's 12 weeks. They rotate through. You can pick whatever time you want to go, whichever sessions you want to go to, and each session is a little bit different. Could be Reiki one week, could be healing touch, could be meditation, could be yoga, and they're all to kind of help reset your norm, because when you're coming back from war, your kind of internal thermostat it's kind of registered a little higher,
Yeah.
right? So you want to bring that back down so you can function with less adrenaline in your life.
That's amazing.
Yeah.
There's nothing you don't offer.
We even have a therapy dog that comes up to
Do
our
you
program.
really?
We
Buddy
sure
the
do.
therapy
I
Yeah.
love
Buddy.
therapy dog.
Uh-huh.
He's great.
Oh, yeah.
He works throughout the whole facility, but he's up in our program on Tuesdays.
Oh, that's great.
Yeah. And we have
Indoor tennis.
Yes.
Tell them about that wheelchair
yeah,
tennis.
We have
Wheelchair tennis.
we just had 6 of our veterans accepted into the tennis national program in San Diego, I believe it's happening.
2 weeks.
Yeah, so that'll be great.
That is great.
They take, and it's not just rec therapy before, I think, people probably heard the saying, like, it's not your grandfather's VA anymore.
Yeah, right.
Okay, so rec therapy before, I think, at least around us, may have been known for just kind of doing bingo and things like that. They still do bingo for veterans that enjoy that. But we have lots to offer.
You sure do.
Yeah, they do things like archery, skiing, kayaking,
There's scuba diving.
Scuba, oh, that is beautiful.
Yeah.
horseback riding.
I guess
And
it's-
I would just
Dr.
add
Pesci.
that stuff is really important to get people back to positive experiences
Sure.
in life.
Yeah,
Yeah,
definitely.
that's great. Let's take a caller. Tommy, hi. Tommy, are you there? Hello, hello, hello. Tommy.
Can you hear me, Cliff?
Yeah, I can now. Hi, Tommy. How are you?
Well, it's always great to hear your voice and
Thank you.
to all your esteemed panelists and stuff. But how do you know when you're getting screwed? You stop and you think about the United States of America. You stop and you think about those who laid their lives down that this country could be what it is today. Then you stop and you think about the debacle and the absolute hypocrisy of all of the veterans and all of the hell that they have to go through just to get the services that they should have, period, for what they did for this country. So I would like to ask you guys to comment on something. If you remember, back in the day, there was this terrible debacle with the Veterans Administration, and Trump was going in there to straighten it all out, and you never heard anything else about it. So my point on all of this is, if you screw the veterans, what do you think they care about the rest of us? I love all of you.
Thank you so much, Tommy. Yes.
So
Go right ahead. Mhm.
Tommy, hi, this is Mark, and
Mhm.
I think a lot of the frustration that I have seen and heard, it's because veterans have not had access, timely access to the services that they really need. So the challenge is, and what I hope that we're doing very well here at Jesse Brown Veterans Healthcare System, is identifying what those needs are, what the how we can provide those, where we can provide them, and like Dr. Passy said, she's going out real time, and she's educating and providing services off campus to a younger generation that I'll tell you what, 10 years ago, we didn't know some of the specialized needs that they had. So the access is really important. And this is a subject for another week, but telehealth. That's another thing that we've invested in significantly at Jesse Brown, and the reason is that can provide alternative ways for the veteran to speak with their provider, again, real time. Don't have to make an appointment, don't have to wait for an appointment. They can access that service immediately. So I think if you pay attention to the access, you pay attention to the services that the veteran really needs, and how you can provide those maybe in a very non-traditional way, that's the key. And that's what we're working real hard on.
Tommy, thanks for your call. And, of course, we're so proud of what is happening over at the Jesse Brown VA. That was Mark, of course, the director, Mark McGill, making the response. Things have changed tremendously. Now, I don't know whether I think it's happened nationally, but I know, because I talk to other people, we are fortunate to have the folks we have at the Jesse Brown VA, because I know it's doing better than the overwhelming majority than the others. I think they're all improving, but we are fortunate to have Jesse Brown, because you folks just do a great job. And
well, I appreciate that, and
I know what happened over there.
Valerie said, the old saying, "It's not your grandfather's VA." And see, I think, and that kind of fits in with what Tommy was talking about. Mm-hmm. It's not the bureaucratic and look for the blue line, go 50 feet, turn right, and look for the red line,
exactly.
and then wait for 5 hours. I would submit it's your sons and daughters VA, and we're taking care of 5 generations of veterans, and you have to take care of them in whatever works best for them.
It wasn't that long ago, I would presume. I've been in radio for some time, but I believe during my early days, probably, who would have gotten anybody on from the VA? What, are you crazy?
It'd be too scary.
That's right. That's right. Let's go to Susan, please. Hi, Susan.
Hi, how are you?
Fine, Susan. Thanks for calling.
Oh, thanks for the program. Wanted to know about the 12-week program. Is that available to all veterans? And if so, where? As well as telehealth, is that available for behavioral health as well as physical health?
Yeah. So,
Okay. Mhm.
Susan, thanks. Those are both very good questions. I love them. Telehealth is actually, we have 2 different types. Telehealth, your traditional telehealth, when you go you go to the VA closest to you, and then you sit in a room with a camera and a TV, and you talk to a provider at another VA that offers the services that may not be at that VA. But we also have a really new, exciting program called Video Vet Connect, and that can be done from your home, your office. Heck, you can even do it from your car on your break from work if you wanted. You can do it on your phone, your tablet, your laptop, and you talk with your provider in their office at the VA, and it could be mental health, primary care, dermatology, everyone at the VA is trying to get in on it and make it easier for access for veterans to come in. The other great thing about it is you can conference more than one person in on this Video Connect, which means if you are worried about your husband or wife and want to make sure that they're actually telling the doc everything that's going on, but you have to work, you can video connect in on the appointment with the provider, whoever it may be. So those are pretty exciting things that are happening. The 12-week program I was talking about is available to returning combat veterans post 9/11 and transitioning post 9/11 veterans in our transition and care management clinic. However, we have all sorts of great stuff happening with Whole Health that are offering these services throughout the entire hospital in all sorts of different areas. We have acupuncture going into our physical therapy and rehab program. So those are available to everyone. And we're really encouraging people to utilize them. We have yoga happening down in the recreation therapy gym. It's just kind of whatever you're looking for, the VA is trying to provide it at this point.
There's even been power breath meditation programs coming through the VA.
Wow. And what area is that through if they're not a post 9/11 returning vet, combat vet?
Your best bet would be to ask your primary care provider and or connect with recreation therapy and the Whole Health program. They're the ones that are Whole Health services and recreation therapy are kind of spearheading most of these, and then mental health is sort of spearheading things like power breath meditation and different services like that. Yeah.
Okay.
Susan?
Thank you. This is powerful.
Yeah.
I want to have it. I'm not a vet, though. Can I get a friend and family hookup?
Well, it would be great.
I can understand.
YouTube.
Yeah, I can sure understand why you're saying that, Susan.
I feel like maybe now civilian settings need to catch up with us.
Yeah,
There you go.
That's right. You know, one thing that was mentioned with acupuncture, I had a problem, and I want to tell you, I didn't like the idea. I'm not into pain.
Sure. Who is?
Well, I you know.
Yeah.
But it works. At least it did for me. It was great. I say everybody, hey, you know, this is a great thing. So that's really something. We have a few more moments left. Mark, what else should we say?
Well, I tell you what,
great information. Great information.
You know, hopefully this gave a little bit more about some of the things you wouldn't normally think that you would be able to receive at the medical center. And so, just like Susan had said, you know, am I eligible? Could I take advantage of that program? Call us and find out.
Yeah.
And of course, veterans that are already enrolled. Go through your primary care doc, and they're kind of the key to hooking up with all these different services. And then one more thing, Cliff, you know, you mentioned the acupuncture, and that's becoming such an acceptable treatment now.
Yeah.
Didn't used to be seen as that, but you know, we're really open to any sort of alternative treatment as long as it can improve outcome. And you know, Valerie mentioned Whole Health and yoga and Tai Chi, and those have helped in many different areas: chronic pain management, relaxation, a lot of other things. So
Battlefield acupuncture, we have people trained in that now too.
Yeah.
What is that?
Battlefield acupuncture,
okay.
which is it's very similar to acupuncture, but it is basically just. The procedure is just in your ear, and they put teeny tiny little needles that go in, and they sort of stay in until they fall out. You kind of forget they're there, but they help with stress, anxiety, pain, and they're kind of more immediate. So one of our emergency department doctors is actually trained in that. So if you're coming in and you're super anxious about whatever's going on, and that setting can heighten your anxiety, she can step in and help with some immediate treatments that are not even pharmaceutical, which some people are worried about and trying to avoid these days.
Well, I just think it's amazing all that is offered by the Jesse Brown VA because, you know, I know that there may be some places that I've been told before because people are able to reach us. There's a lot of ways people reach this program. And we are fortunate. We want, of course, the VA to do well across the country, but people are saying, "Hey, you folks are really fortunate there." I said, "Yeah, well, we are."
Well, and I'll tell you, the other key is just having such awesome partners. I mean, like America's Heroes, and all the community support we have. That's another reason that VA healthcare is the best.
Yeah.
Yeah.
Well, it sure is. It certainly is, and we'll continue. And you're going to stay with us as we continue over the months to make sure that we do that. So that's great. You want to close us out, sir?
Well, there's a beautiful weekend today.
Yeah.
Get out, I guess, enjoy the last couple hours of sunshine, because I hear it might snow tomorrow. Is that correct? I don't know.
We talked about that earlier.
So, but no, again, Cliff, thank you for everything that you and your group do, and just want to tell our veterans how much we appreciate you, and God bless.
Thank you so much, and I want Ms. Creighton, you want to give us a goodbye?
Sure. I want to thank all our veterans that are listening for the services they've offered us. And if you have any questions, or any returning combat veterans that are nearby Chicago, please send them on in to see us. We can do walk-ins or appointments, and we can be reached at 312-569-5900.
Great. Dr. Passy?
Sure. So I would just like to thank you again for having me here, and to encourage any student veterans or any campuses that might benefit from engaging with the Student Veteran Outreach Program to contact me. I can be contacted at 312-262-8007.
Thank you for
you.
coming in. Appreciate it. Stay with us now. We'll be going to the second hour of America's Heroes Group right after this.